Today is World Tuberculosis Day, marked each year to draw attention to the efforts to end the global TB epidemic. The highly infectious disease has largely been eradicated in the industrialized world, but kills more than 1 million people a year in poorer countries. India accounts for more than a quarter of cases, and despite setting a goal of eliminating TB by the end of this year, now critics say that's unrealistic due to low government spending and shortage of medicines. DW Correspondent Adil Bhat has been to Faridabad in the northern state of Haryana to meet patients fighting the disease.
A silent enemy has taken hold of this neighborhood in the northern state of Haryana, tuberculosis. Mahesh Kumar was recently infected with the deadly disease. At the moment, only his lungs are affected, but it could spread to other parts of his body at any time. He is currently on a mix of pills that leave him tired and drowsy.
It feels like I'm living life in a jail. I'm like a prisoner. I spend my days and nights here all by myself.
Mahesh was diagnosed 4 months ago. The government does offer free TB medication and a small food allowance of 10 euros. But Mahesh says he hasn't seen a penny of the allowance.
I'm very upset with our government. They promised us support, but I haven't received any money from them. We're hoping they support us so that I can recover fast. In our city, there are no hospitals and machines for health checkups.
Mahesh's case is not unique. Widespread poverty, poor hygiene, and overcrowding have fueled its spread, affecting over 2 million people nationwide. This private hospital treats dozens of TB patients every day. For the first time in 3 months, Mahesh has been able to make the long journey here for a checkup. His consultant, Dr. Lauleen Mangla, finds the overall situation alarming. He says a shortage of medicine and lack of public awareness are causing the delay in the eradication of TB.
I'm practicing in this area from last 5 years, and the number of cases which I was seeing 5 years back also they're still same, and I don't think there is any decline in the number of cases.
In 2018, the Indian government pledged to eliminate tuberculosis by 2025, a goal it's now very unlikely to achieve. After India's health ministry did not respond to several interview requests, DW turned to a public health expert for insight.
If I may put it in a matter-of-fact manner, the government never was serious about it. But government can do the propaganda. That's what they're doing. Even when we had our GDP rising by at 11%, 12% a year, even in those times, health budget stagnated. Okay, health budget is stagnant even now. So on what basis do we believe that yes, it will be eliminated?
Aid agencies like the Red Cross are stepping in, raising awareness in slums where tuberculosis outbreaks are common.
The biggest challenge that we face is people's hesitation in coming out as TB patients. They do not want to share that they are infected with tuberculosis because they fear the social ostracization. Our job is to dispel that fear. Anyone who coughs for more than 15 days could be suffering from which disease?
Back to Mahesh's home, he hopes he will eventually conquer this chronic illness. But one of the hardest parts is the loneliness that so often comes with the disease.
And for more on this, I'm joined now by Dr. Lancelot Pinto. He is a pulmonologist and epidemiologist at the PD Hinduja Hospital and Medical Research Center in Mumbai. Dr. Pinto, good to see you. We just heard in the report that it looks highly unlikely that India will achieve its goal of eliminating TB by the end of this year. We heard an expert say that that is because the government was never serious about it. Would you agree with him?
So I think the goal for eradicating TB by this end of this year was always ambitious to begin with. But that isn't necessarily a bad thing. It's good to be ambitious because it has led to a sense of invigoration in the entire program. various aspects of the disease are being looked at. So the conventional paradigm that if a person coughs for more than 2 weeks, then you report to a healthcare center and then work them up for tuberculosis. I think that paradigm is being changed a little bit. There is a move to start actively seeking and looking out for TB in the community. The reality is that the 18% reduction that we've achieved since 2015 is better than a lot of other high burden countries, but the sheer magnitude of the disease suggests that we all want to do a lot better than that. But as you rightly pointed out earlier in the program, TB is not just a disease caused by a mycobacterium or a bacillus. It's a disease associated with poverty, with malnutrition, with immunity. There's a lot of stigma around the disease, and all of this will need to come together. We will have to address all of these if we truly want to eradicate the disease.
What are the focus areas you think the government should be looking at?
So I think we've always focused mainly on treatment, and we've always thought that medications are a silver bullet which will solve all our problems. But I think the move needs to go towards prevention and early diagnostics. So there is a move through the Nikshay Poshan Yojana, for example, to provide nutrition to families of those who have tuberculosis. And we know that just improving nutrition can prevent the spread and the development of TB in close contacts. There are cash transfers which are now in place, which again have shown success. And we've actually started looking at treating close contacts of those with tuberculosis. So this would all fall under the umbrella of prevention. I think we need to work a lot harder when it comes to diagnostics. So smear microscopy, which is used for over 2/3 of people as their point of diagnosis, misses out about 40% of all patients with TB. So we need to phase out smear microscopy and move towards molecular tests. I think the state of Goa recently achieved 100% diagnostics with molecular tests. And I think that's the way forward to pick up the disease at an early stage. If you pick up the disease at an early stage, not only do you treat patients early, but you also arrest the spread in the community, which I think serves two purposes. And then, of course, active surveillance. So conventionally, we waited for patients with symptoms to reach the healthcare system. I think we're now realizing that a good proportion of patients have asymptomatic disease, and actively surveilling using AI, using radiographic techniques such as X-rays is the way to go forward.
TB patients are often ostracized, Dr. Pinto. What can be done to change this and to support them better?
I think we need to have more of an engagement with the community, making them realize that TB cuts across all kinds of socioeconomic status. It cuts across the rich, the poor. I think some celebrities have come out and shared their experiences of tuberculosis. I work at a tertiary care private institute, and we see people of all sections of society having the disease. I think normalizing having tuberculosis is the first step in eradicating stigma. I think the language that we use also needs to change. We've traditionally referred to people as cases. We've referred to words like defaulting on treatment rather than engaging with people, educating them, and looking at it as a journey together.
We'll leave it there for the moment. Thanks so much for joining us today, Dr. Lancelot Pinto.
Thank you.
I'm now joined by Sandeep Ahuja. He is the founder and CEO of Operation Asha. That's an India-based NGO committed to fighting tuberculosis worldwide. Welcome to DW News. The expert in our report said that a lack of medicines and public awareness are behind the delay in eradicating tuberculosis in India. Do you share that assessment?
That's absolutely right. It's actually just not the lack of information. I can tell you every poor patient we treat, and by now we've treated something like 250,000. Every patient we treat knows what he's suffering from. The trouble is terrible stigma. Even after diagnosis, patients don't want to admit they have TB because they fear they'll be thrown out by the family and by the society, by the village. Married women have been thrown out by their husbands, away from children. They've been kept in seclusion. So the problem is not one-dimensional. It's a multi-dimensional problem, and the solution has to be multi-dimensional.
Right, and if you could talk to the solution there, especially in the aspect of access to medication, which we understand is difficult, but your organization's also developed a model to significantly improve the fight against tuberculosis. Could you tell us a little bit more about it?
Oh, absolutely. As a matter of fact, the government of India instituted, made a large committee way back in 2016 to study our model and see what it could do. And the committee, which was headed by the director of the National TB Institute of India, commented that the moment we enter any area, the detection rate goes up tremendously and much, much above the national average. Not only that, the treatment success rate achieves unprecedented high levels. They actually recommended that that our technology be expanded countrywide. However, that report has not even been made public by the Mandarins in the health ministry for the last 6 years. I don't know what's going on.
So we're hearing that India will miss the target it set of eliminating TB by the end of this year. What do you think would be a more realistic target?
Oh, I actually met the private secretary to the Prime Minister about 5 years ago, and I told him 2035, and I flatly said, I don't agree that 2025 is possible in any way whatsoever. So honestly, after the government fights, let me put it this way. First, the government has to find a good model. If they think that their current model is working, they're living in a vacuum. They don't know. I mean, your patients have said how they're suffering. Your experts have said how people are suffering. So first of all, the government has to accept that the model is not working. They're wasting money, whatever they're spending on it. They have to come up with a good model. They have to probably follow the guidelines or the recommendations laid out by the committee to expand Operation Asha's model across the country. And once they do that, I can tell you, without mincing any words, 20 years. That's how long it's going to take to eradicate. I'm not going to use the word elimination. Elimination means 0 cases. Eradication, the way WHO defined it, meant same level of TB in developing countries as developed countries, something like 50 cases per million. That was eradication. It will take 20 years to eradicate. Elimination, honestly, I don't know, maybe 30, 40. Without a vaccine, maybe longer.
Well, Sandeep Ahuja, the founder and CEO of Operation Asha, we appreciate your insights. Thank you for being on DW.
Thank you, and I hope this makes the world a better place for TB patients.